Hello and welcome to today's video on physical activity, metabolic health and type 2 diabetes. In this video we will be looking at metabolic syndrome and its relationship to type 2 diabetes, what type 2 diabetes is and why it's such an issue and why physical activity is important in the prevention and management of type 2 diabetes. Metabolic syndrome is a cluster of the most dangerous risk factors for cardiovascular disease. It is defined by central obesity or excess fat around the midsection, accompanied by two or more of the following risk factors: raised fasting plasma glucose, low HDL cholesterol levels, high plasma triglycerides, or hypertension. It's important to remember that each risk factor alone increases an individual's risk of cardiovascular disease, and as such, the metabolic syndrome collection poses a substantial risk. The metabolic syndrome also carries a 5-fold increased risk of developing type 2 diabetes. So what exactly is type 2 diabetes? Type 2 diabetes has become one of the major causes of premature illness and death worldwide. 6.4% of the UK population have a diagnosis of type 2 diabetes, with the elderly population being at the highest risk. Patients with type 2 diabetes have an approximate 50% increased risk of cardiovascular disease and are at risk of numerous other macrovascular and microvascular complications, including stroke, loss of vision, chronic kidney disease, peripheral artery disease, and peripheral neuropathy. Type 2 diabetes is characterized by insufficient insulin production and insulin resistance, resulting in a chronically raised plasma glucose levels. Long-term exposure to high glucose levels are toxic for cells, meaning the longer someone has type 2 diabetes, the higher their sugar levels and the higher the chance of developing complications. There is a way to combat the increasing trend in type 2 diabetes, to some degree. The disease can be prevented and managed through lifestyle changes, such as reducing dietary fat and sugar intake, losing weight, and increasing physical activity levels. Even if a patient does not lose weight, physical activity can reduce the risk of long-term complications. Systematic reviews and meta-analyses have shown us that small increases in leisure time physical activity can result in a large risk reduction of developing type 2 diabetes, and this acts in a dose-response manner. This particular meta-analysis found that 11.25 MET hours a week, equivalent to 150 minutes of moderate physical activity per week, results in a 26% decreased risk of developing type 2 diabetes. Further reductions in risk were also found from doing even more activity. This response has been demonstrated in a multitude of studies, showing just how strong this relationship is, with the Department for Health acknowledging that physical activity can result in a 40% reduction in the risk of developing diabetes. Despite this relationship, rather shockingly, recent statistics suggest that only 66% of men and 58% of women in the UK are meeting the National Physical Activity Guidelines. Although this is likely to be an overestimate, as the figures come from self-reported questionnaires and are generally subject to issues of misinterpretation and social desirability. Even simply walking more in the day conveys great health benefits in both reducing type 2 diabetes risk and your risk of subsequent cardiovascular disease, particularly in those who are at higher risk already. These patients may particularly benefit from being more active. Prospective evidence examining over 9,000 individuals showed that a 2,000 step per day increase was associated with an 8 to 10% reduction in cardiovascular risk, no matter how active an individual is. Physical activity is crucial in the management of type 2 diabetes. Meta-analysis have found that giving physical activity advice or undertaking structured aerobic or resistance training programs are all effective at reducing HbA1c, a blood marker for diabetes severity. HbA1c decreased by 0.73% with structured aerobic training, 0.57% with structured resistance training, and 0.43% with physical activity and dietary advice alongside. Furthermore, programs that included greater than 150 minutes of physical activity a week had a drop in HbA1c by an even further reduction of 0.89%. If sustained, these reductions likely confer larger reductions in morbidity later on in life. In summary, there is an increasing number of people being diagnosed with type 2 diabetes. Physical activity can reduce an individual's risk of developing type 2 diabetes by up to 40%, and physical activity is an effective means of managing a patient with diabetes. Thank you for watching. For further information, please see the links presented shortly. And please remember that patients are more likely to continue being active long term if it is something they enjoy, if they start slowly and gradually build up, making small changes at a time, and if they vary their physical activity type and make it social.